Welcome to my podcast. Today I'm going to talk about skin problems in general. So basically, when a patient comes to you, after you introduce yourself and double check the patient name, date of birth, and address, you will ask what brought you to the surgery today, basically. And the patient will tell you, oh, I have a skin lesion and I'm worried about it. So you need to ask, can you tell me more about it, for instance? And then ask the patient what's their thought, what's their idea, what could be the reason for this skin lesion, because sometimes patients do know why this happened. And also you need to ask about which area of the body is affected and how long ago it's been there, if there is any associated itchiness or bleeding or pain, if there is any history of sun exposure or traveling abroad or using suntan, because some people, they like to use suntan, and you need to ask if they have done anything in regard, and if they have seen the doctor before or not, and if they have noticed any change in the shape or in the size or in the color, or if there is any associated fever, for instance. This will cover, of course, meningitis. Also, you need to ask if there is any bleeding. This would rule out BCC. And if there is any discharge, this will imply skin infection, generally speaking. Also, in regard to color, if, for instance, the color has changed to get darkening and become heterogeneous or ragged, not defined, all of that could imply sinister skin lesion like malignant melanoma. And also you need to inquire if there is any associated, apart from fever, any lumps and bumps in the body. This could, of course, point out to sinister skin condition. You could ask also if there is any weight loss, if there is loss of appetite, feeling fatigue, and the patient will answer in regard. After ruling all of that, you will ask, of course, about any chronic medical condition, if there is any medication being taken on the long run, like, for instance, immunosuppressant for certain medical condition, which will exaggerate appearances of SEC and other skin condition. You need also to ask about if there is any known skin allergy, and what's the patient living status, what's their career, or if they are working, what sort of a work is that. So maybe it could be in the field, all the time exposed under the sun. If they are using any sunblock, for instance, you need to ask about all of that. And also, after asking about all of that, you need, of course, to ask about smoking habit, alcohol intake, and also if there is any main worries for the patient that they are concerned about. Say, for instance, if there is any family history of any skin cancer like malignant melanoma. After you've been asking all of that, you need to examine, of course, the patient based on the examination. In Plab 2 examination, whenever it's a skin lesion or skin rash, after you take the history and everything, and then they will hand you a photo of a skin lesion. So basically it could be malignant melanoma, it could be BCC, SCC, seborrheic keratosis, wart, skin tag, all sort of simple skin lesions. When you see that, you will comment back to the patient and explain what's your thought basically about what you are seeing. And then you will agree with the patient about the management plan. So you will tell him or tell her, I think this is blah, 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 and we need to do this in regard. For instance, if it's malignant melanoma, you will advise about the two-week wait whereby you will refer them urgently to the dermatology department, who will take that case and manage it. If it's tuberculosis, you will explain to the patient that there is nothing to worry about this, and it's something that we do see as we age, and there is nothing wrong with it, and can be treated accordingly, because sometimes patients they have itchiness. It causes sometimes irritation if it's extensive. So there is different ways to be treated, including cryocottery. If it's other skin cancers, non-melanoma, like BCC and SCC, so this is basically, you will treat accordingly, I mean, because there is different types. And also, you might send as well non-urgent for dermatological department, whereby they will deal with just cases. And if it's a skin tag, for instance, or wart, this depends on the surgery, basically. If they have the facility for minor skin surgery, you will arrange for that to be dealt with. If not, you will explain to the patient that there is nothing serious with this, but it will need those steps to be taken to treat it. So by that, I hope that I covered some of the briefing about most common skin lesion that can be seen in Plab 2 examination. And of course, when you conclude the consultation with the patient, always you need to say if there is something that doesn't seem right, or if you feel that your condition is not improving, you need to come back again to us, and we'll take it from there. Thank you.